Chiara Broccatelli es investigadora Marie Curie del GRAFO, Grupo de Investigación de la Universidad Autónoma de Barcelona, e investigadora honoraria de la Escuela de Música de la Universidad de Queensland. Chiara obtuvo su maestría en Sociología e Investigación Social en la Universidad de Trento y su doctorado en Sociología en la Universidad de Manchester, donde estudió en el Mitchell Center for Sustainable Analysis. Ha sido asistente de investigación en la Unidad de Ciencias Sociales y de Salud Pública de la Universidad de Glasgow y miembro visitante del MELNEC de la Universidad Tecnológica de Seaburg en Melbourne, así como investigadora del Instituto de Investigación en Ciencias Sociales de la Universidad de Queensland. Su principal interés se centra en la comprensión de las relaciones sociales y sus efectos en la salud individual y colectiva, a través de la aplicación de teorías y métodos de redes sociales. Actualmente está analizando cómo desarrollar una red integrada de proveedores de servicios de atención a la salud mental. Para ello, investiga los mecanismos que facilitan las estructuras de red multinivel capaces de impulsar un modelo integrado de atención de salud mental en Cataluña.
So please, I wasn't sure about the type of audience, what are you guys interested in? So if there is anything that you want me to maybe go into one direction. So please feel free to let's have a conversation. So stop me and ask things, and let's do things in an interactive way. So what I'm going to talk about is these multi-level networks and integrated healthcare in Australia. You are going to see that I also have some pictures. About the UN campaign that is happening right now from the 25th of November until the 10th of December. And I'm going to talk a little bit about this also later on. So my presentation today is going to be about this picture, this art wall. So we are going to go through the story of how I ended up having a heart wall within the Children's Health Hospital in Queensland. In order for me to explain you the story of that picture, I have a plan. And my plan is that we are going to discuss a little bit what Project ECHO is, what I was studying, how I ended up involved in the Children's Health Queensland Hospital, a little bit of background and the context. Then I'm going to talk a little bit about the multi-level concept in network healthcare. And then I can talk a little bit on this, depending on if we have an interest on that. Otherwise, I will skip a little bit. And then I will talk about my research questions, my hypotheses, how I ended up designing a network research for what I wanted to study, and a little bit of conclusion and results. Okay, so also a little bit of myself. So I used to live in Mianjin, which is the traditional name of the city called Brisbane. Very lovely place. I also recommend to have a look at this website here, where there are plenty of very nice maps, a little bit different. And while I was in Australia, I was obviously going to the beaches. So this is in Cairns, I think, Fitzroy Island, maybe. And this is I also visited the Northern Territories in the around the Kakadu National Park. And I was also feeding wallabies with my friend Yanshu. But while I was also there, I ended up working with the Children's Hospital within this project called Project ECHO. Now you have to think that when Project ECHO started, it was on 2016 when it has been implemented in Queensland. On 2016, we didn't experience the pandemic yet. And the whole project is about creating those video conferences. So Zoom meetings, now we all know what they are. But back then, it was a very innovative strategy. And the idea was to bring together health professionals, nurses, or anybody working in health on a specific topic and discuss cases. Now, when they were like joining those video conferences and discuss cases in an anonymized way, they were sharing knowledge. This is particularly important in an area, in a big country like Queensland, because Queensland is huge and some of the people are really struggling in accessing healthcare, especially in some of the most remote and rural areas. So the whole idea was to bring together doctors so then they could have discussed cases and also share ideas, knowledge, way of treating patients, so that they could. So the whole goal, the whole mission was to create a better quality of care. So when Philip, who is here, at some point sent me an email and say, I think network analysis can be useful. Now let's go back. And then I say, okay, maybe network analysis, yes, can be useful, but do what? So then we started to discuss a little bit. And then we ended up talking about using social network research to understand a couple of three things, really, we wanted to understand within this Project ECHO. Because Project ECHO has never been evaluated in the sense like, is this really useful for passing knowledge to help the quality of care? Now, we are not studying patients, and this is a limitation, but we are looking from the point of view of the doctors. Are the doctors really connecting and sharing ideas and knowledge? So that was the first point, looking at the health system and looking at how Project ECHO is embedded in this and providing the opportunity to let people meet and discuss cases. The second thing, it was to collect, I think someone was open, maybe. So the second thing was looking at, is it feasible to apply social network analysis in this context? Because network analysis is a way of understanding something in the social world, but it's not the best way and it's not the only way. So I was also interested in understanding how feasible it was. The third point, it was more into understanding, okay, we have doctors, those doctors are sharing knowledge and interacting, how the network is looking like, how those connections are embedded within the healthcare system, how those relationships are utilizing the informal and formal ties that can always happen in the human context, and how we can map those relationships. Okay, so I love this gene. This is a 4-pillar. I really recommend if you're going to Australia and you haven't had the chance to try this. Very nice. Actually, this is from Melbourne. But when I was thinking about, okay, we need to find a way to evaluate Project ECHO and the ability of Project ECHO to create connections, I was inspired by the bottle of gin, but most importantly, I was inspired by the Medical Research Council evaluation guidelines that been my previous work in Glasgow. So when you are approaching an evaluation, there are always several parameters that you want to evaluate. And then I tried to come out with something similar for my evaluation framework, which is not an evaluation in the sense that it's using the same techniques and ideas like in public health, but in a similar way, what I want to do is to make sure that my social network generated the results are giving some answers to those points. So my point is, okay, we have Project ECHO, we have relationships. Is Project ECHO acceptable? So the dimension, the pillar of acceptability, how people are engaging through that project. Second, capability. Are more individuals, are there some specific characteristics following which some people becoming more interactive and sharing more knowledge than others? Can we identify some capabilities based on roles or sectors? The third thing was the level of reachability. So we have a network. Within a network, there are clusters, there are groups. Where those groups are geographically posited, or there are different ways that explain those clusters and those groups. And the third thing, what is the level of integration within my network? I am not going to talk about all those points in this presentation because I've been using different network measures and different network tools to identify some of those level of related to the 4 pillars. But I wanted to show you the original, the main framework. And then I'm gonna talk a little bit about the capability and the integration mostly. Okay, let's talk about the context of the integrated care and the children health. This is coming from the children health strategy document. So the idea that they developed, everybody has their own idea of what does it mean integrated care. So there is no any universal definition. Okay. Then within the children health, they have been using this definition, which is very broad. And then this is the idea that well-being, it's an holistic concept. So you don't really treat the patients that in that case are the children, but you want to make sure that you have the children, you have the families, you have the people around the children. And then you want to make sure that the point is of the integrated care is to provide well-being and health, I mean, quality of care along different dimensions. So the physical point of view, the psychological point of view, the social point of view. If you're following this definition, we have different type of factors, and all those type of factors have to interact together in order to provide a good quality of care. So how the system looks like is quite a mess really, because you have the general pediatricians, then you have the family doctors, then you have the nurses, then you have people at the hospitals, then you have people in the primary care, then you have people in other health workers in other service providers. So when I came in, I was like, okay, this is the situation. How can I use the network analysis? What does it mean that I want to apply the network analysis in that context? What does it mean that I'm going to use the social network research lens? I didn't say that at the very beginning, but I've been working on network analysis pretty much for the past 10 years, and I've been applying the methodology in so many different contexts, from the social movement, from the criminal networks, from the online networks, health, network interventions. So for me, applying the methodology and be rigorous with the methodology is probably who I am as a scientist. So for me, this is a very crucial point, try to understand how am I going to use the network analysis in a good way to answer some of the questions related to my framework. So what I realized is like, okay, we have Project ECHO and we have this inter-organizational healthcare environment. So we have the physical, psychological, and social all together. We have different professionals, different roles, different sectors. There we go. Then it's easy because it's just like thinking and using a multi-level lens to develop network design. So what does it mean? So you can imagine that within the healthcare system, we have different networks. And those networks, you can imagine those in different levels. So this is coming from the literature. I'm not going to go into the details of that, but that's for another opportunity occasion. So, but you can think that the doctors are put together. These are also part of other services within another level, within maybe the same environment, but also within the same geographical space, but could also be outside some geographical space. Those people are also talking together. And then we have the doctors who's also talking with the patient, and then the patients are also part of family. So we have the clinical level, the organizational level, the community level, because those people are embedded in communities, and then we have the family level. So now we slowly are getting into this idea of applying the multi-level lens and the multi-level network analysis, because in my case, what I'm going to do with Project ECHO is literally here. What I'm planning to do with Jose here, it's also include probably this bit. But for now, and Project ECHO is an example of what does it mean focusing on those levels. So 2 levels. We're gonna talk a little bit about this. So this idea of multi-levels is something that we have been, and when I say we, I'm talking about some of the colleagues at the Melnet and the Melbourne University. We have been working on this idea for probably 2 years. So we met every week on Thursday morning at 10 o'clock online to talk about this. And we ended up eventually having a paper. And then that was a very good experience, because we really try to unpack this idea of multi-level networks, and in particularly we were focusing on network interventions, but the main point is still like using these multiple levels of analysis. So we have 3 levels. When I talk about multi-level networks, I'm always considering 3 things: the local perspective, the setting, and the system. Now, the local, it's easy because we have we can focus on one individual or a diet. So we can focus on the relationship between the individual and someone else, or even within the personal network. So it's very local. Things are getting complicated when we are talking about the settings and the system, because the setting and the system are like here. How to define those boundaries here? That depends. The answer is it depends, because if I want to look at one school, okay, the school becomes the system, and the classrooms within the school are my settings. But if I want to study the whole educational system within a state, then the whole educational system becomes my system, and each school becomes a setting. So the level of system and setting are really complicated to define, and those are not fixed. But the principle is fixed, but then you have to apply this into the network research design. What does it mean? Okay, so it meant for me that if I wanted to use the multi-level lens with this idea of the interlayers, linkages across levels, I needed to collect data. The first thing is to collect the data, because if I don't collect the data, then I won't be able to see this retrospectively. So I need to make sure that my research design helps understanding those levels and the interactions in between and across those levels. Then I need to include those results and to have a systematic way to use what I'm finding to put it into a evaluation framework, because otherwise, what is the point? So 3 points. And now I'm going to talk about the methodology more specifically and my data collection. So this is the time where if I have to clarify something, probably it's, yeah, otherwise I'm going to keep on talking. See?
But if you can take as a system, like the whole, let's say only one school, no? Which, you know, I think in anthropology we really relate to that because we often like consider particular contexts, no? But in that case, like, where's the rest of the world? And what's with the rest of what's staying outside, no? If your macro area, no, the big area, the system area is only the school, how do you still take into consideration the global level? You know what I mean?
Yes, yes and no. So in sociology, and especially network research, you're focusing on the relationships. So the whole point is to collect and understand one type or maybe few types of relationships, right? So then really your understanding is related to that. You won't understand everything about the system. So there are different ways of doing this, and probably network analysis is one of the. But what you can do is to answer questions related to the type of ties that you are like on the routine, you are like wanted to. Then you can think of doing a parallel research into another system, or you want to compare, like for example, one class with another. But within in the network things, it's very difficult to make a comparison between one group and to another because network ties and network relationships are always different. And then you cannot really control all the dynamics and everything that is happening. You have like a small pictures, and then you might think of something, but that's it, like all the research. Yes. I'm not sure if that was your question, but yeah, we can always talk about it. So when I started to work with the children health, we were talking about developing this research. And now, especially in public health, it's very popular, this idea of co-design. Now, what does it mean, co-design, for my past experience? It meant that we actually met once a week, sometimes even more than that, to discuss how to develop a questionnaire, how to create, to define the network boundaries, how to engage with participants, how to identify roles, how to identify levels of services and fields of medicine, of healthcare. So for me, the co-design, it was actually working together very constantly. And then we really met once a week for 1 year. And then we kept on meeting also last year because we were enjoying working together, and we were writing 2 papers actually. So we kept the habits of talking. So we had 2 groups. So Project ECHO started in 2016, and we had few groups. One, it was doctors and people working in health. They were working with children with disabilities. And this group has been running for probably 3 years back then when we collected the data. And the second group that we analyzed, it was a very new group of doctors who starting to join Project ECHO and join those video conference, video calls. That was related to the Aboriginal and Torres Strait Islander doctors. So the people working in joining that ECHO project were working with children coming from the indigenous Australian community. And this was very new back then. So they really started probably a couple of, maybe 3 or 4 video conferences, so they really didn't know each other very well. And the reason why we wanted to compare those two, because we was like, okay, maybe there are some dynamics within one network that has been running for quite a long time, so that are different within the other network. So the type of style, the people who have been working with me, they know that my point is always to think about what is the type of style. I'm always asking this question with everybody that I'm working with. What is the type of style that you have in mind? And now the big review. So in one of our meetings with the people at the Children's Health was to discuss, okay, we want to know to what extent Project ECHO is a valuable tool to create connection. What type of connections are we going to map? So we started to look into advice seeking behaviors. So who is talking to who for guidance, cultural advice, to share ideas. We ended up using this very small, we can talk a little bit, I mean, I'm not going to talk about this because that would make me bring me into a different path. But defining the right question and the right way of asking this has been probably our topic of discussion with the Children's Health for probably months before we ended up choosing this. But anyway, the idea was to find a way to capture those formal and informal styles. So what does it mean? It means that, okay, I have my supervisor, so I'm going to Jose and I'm going to ask questions to him because, you know, he knows, right? Okay, but this is also part of his hierarchical role. So the second thing was also to map the informal styles, which means like how do people go and grab a coffee with someone because they wanted to get some information. We always have experiences in okay, you know, I can talk with my official supervisor or something, but I can also have some friends that I can also ask questions. So we wanted to capture those dynamics, the formal and informal. We try to avoid the ambiguities, which is a huge problem, especially when we are asking about collaborations, with who are you engaging with, what does it mean? So I do have a really strong opinion about, and I agree with the literature that asking with who are you collaborate with is never a great idea. But anyway, the other things that we did, because we were in the pandemic also situation, so we couldn't really collect the data face to face. So what we did, it was to create video conferences specifically for collecting the data, where people were able to come in and ask questions and do the survey while we were there supporting them if they wanted. Okay, so it took us a little bit of time, and then we used poultry. It was a very complicated task using poultry, so I don't recommend it. But somehow it was a little bit interactive. We embedded a video from the coordinator, so it was an interesting way also to design this survey with that specific tool. And now, how did we collect the data? Well, we started, well, I think this is a little done, but yeah, we started with people within ECHO, and we asked them to report the ties that they had, the sharing knowledge, the sharing information with the people within ECHO in each separate group. Then we asked them to report information about the external people that they are like asking for information, but we wanted to know the institution. So we had a roster of institutions coming from all the institutions where the people from ECHO were attached, were working. So we asked them to report with which institutions they were connected with. And then we asked them to report the names of the people with whom they interacted within those institutions. And then we asked them the after ties, which is something that you usually don't do for a whole network approach. Well, I'm going to go into the details of that, but I just wanted to tell you actually. But we also collected the data for the after ties to understand if the people that they were interacting with within the other institutions, they were also connected each other, following their perception, their opinion, and to what extent those people were also linked with the people in ECHO. So we reconstructed the whole network. We wanted to do a snowball sampling. It didn't work. So we only have this. And those are my networks. So we identified some, this is the one mode, very simple. Here, the idea is to understand and look at the colors. We identified different roles. Well, my people at the children had identified different roles. The only things that I want to suggest that I want to focus on in these pictures is the red dot. Because the red dot are the cultural programs. What does it mean? So this is a very interesting result. And in fact, we also have one paper that is all about data. But basically, there is not any official recognition for the Aboriginal and Torres Strait Islander people who are like mediating between the traditional health and the Western health. So if a doctor within the hospital, somewhere within the Western tradition, wants to treat a child coming from an indigenous Australian community, you need someone who's mediating, because otherwise the intervention is not working. The thing is that the people who are like acting and that are like so important for delivering quality of care are not recognized in the health system. So that was probably one of the first proof that those people are really useful and they are really present within a network. Okay, I think I have to move. So let's move. So this is the networks based on the type of field. So we have here in the disability network, we can see that there is a huge connection between the education and health than compared to the other. Okay, but then we were talking about a multi-level network. So now I show you something. Okay, the pictures, it was nice to show in a different way, but I think some of the statistical analysis that I'm going to present now are actually based on this idea of multi-level. So we are back to the point of the multi-level. How those statistical things are working. Okay, I'm going to do this. I'm not going to talk about this. This is for another occasion. But there are interesting books and then tons of literature about that. But those are statistical tools that are specifically designed for network analysis. Why do we need, I always have people asking me that question, why do you need specific tools? Why can you not just use traditional statistics? No, I cannot. And that is the reason why there are specific tools, statistical and analytical tools that we can use networks, apply for networks. The reason is because when we are like working with network variables, the focus is on the relationship. And those relationships are dependent on each other. So I am a friend with Jose. Jose is a friend with Jordi. And then I become friends with Jordi. So my relationship with Jordi is not independent from my relationship with Jose and Jordi's relationship with Jose. So when we are using traditional statistics, each observation, so each type, should be independent. But this is not the case in networks because types can force the formation of other tasks. So you need to have specific design models that don't take into account the independence of the relationship. And how those works is like you have the model, you are looking within the model, what you do is like you are searching for patterns, and all those patterns are type of social processes or tendencies. And then you choose those patterns based on your hypothesis, based on your research questions. So some of them are structural. So within a network, you know that you might always look for reciprocity, which is the type variable that comes from one node to another. But also you can look for transitivity, which is the idea that I'm a friend with Jose, Jose is friend with Jordan, Jordan is friend with me. So those processes and tendencies are explained, and then they make sense within a network, and are also based on the hypothesis that you want to. The reason why I'm telling you about this is because this is the key to then understand which are my parameters and the reason why I've chosen some parameters compared to others. But basically, this is the idea that then you compare what you find within the network with a bunch of simulated networks, and then you can identify the probability of having this property, this tendency within your network compared to the randomness of your simulated ones. Anyway, let's look at the hypothesis. So the first hypothesis is this, which is the idea that within our network, so we have a Project ECHO disability, Project ECHO Aboriginal and Torres Strait Islander doctors, and we are assuming that people are creating those structures, and specifically this one because multi-level. So we have the people within ECHO that are also connected quite likely with people outside, so with someone else. And they're also sharing the knowledge in a triangular group very-type structure. So A is talking to B, B is talking to A is talking to A is talking to A is talking to B, B is talking to A. And why this is why we got this idea? Well, because in the literature it's quite proves that we find this quite often because of a hierarchy. So the boss doctor, and then two doctors who are asking information to their boss, and they're also sharing the same information. But also because of the sharing of ideas, it's quite common that people are sharing advice, and sharing ideas is very triangular way of patterns. And yeah, pretty much. And we also were thinking that also within ECHO there are some triangles. There is some closure. Well, the second hypothesis, it was related to the capability, so to the roles and the sectors. So what we were thinking is like not to find people interacting necessarily within the same roles, and also with people embedded in the same sector. And that is because the whole idea of having an integrated care is like you can combine expertise, different type of expertise. So we wanted to have people from different roles and different sectors to interact. The third hypothesis, it was related to the brokerage, and the fact that we found those very key, we know from the literature, I mean the children, the people working at the children's health really told me the importance of having those broker figures. And in the literature, it's quite common to have, especially in health, those combination between being a broker and also being very active. So it's called the brokerage conjugates. So this is the idea that I'm the mediator. So I'm mediating between two people. So those two people are not connected, but through me, they are connected. And I'm doing this with many couples, with many pairs of nodes. That's why multiple brokerage. Okay, this is the result, which I'm gonna skip. There is a paper potentially coming that explains all this eventually, submitted in September. Who knows what is going to happen? Let's go back to the framework very quickly, because I want to say that I'm going to talk a little bit about the dimension of integration, reachability, and capability, but just a little bit. So the capability, I'm going to say something, but not too much, because really we did find something within ECHO in terms of ties and reciprocity and homophily for people within ECHO. So having the same roles and being in the same sector, it was actually a driver for knowledge sharing and knowledge sharing behaviors within ECHO. We didn't find anything in the Aboriginal and Torres Strait Islander network, and we did find hard results for roles and being part in the same sector, multi-level, so across services and institutions. We can talk about what does it mean, if this means collaboration or competition, because people might be willing to share and connect with someone else with a different expertise, and this is a very good for collaboration, but maybe they don't want to have necessarily someone with the same expertise being in the same team, because I want to be the best, so I don't want my colleague to also know in the same thing. So anyway, this is something for another discussion. Now, the other things that we found, very interestingly, is we only found the brokers and the idea of being engaged in multiple connections in the Aboriginal and Torres Strait Islander network, and we couldn't find much of transitivity there. But we could find transitivity and closure, even across level, within the disability network, and we didn't find the brokers. So disability, a lot of closure, lots of triangular structure. Aboriginal and Torres Strait Islander, brokers and multiple super. Now, when I was presenting those results with the people at Children's Health, we were discussing on how this is it could be the result of the strategy that the people coordinating the whole network were actually putting in place, because this is the two-mode projection for the one-mode for the two-mode networks. This is the one-mode projection for the two-mode networks related to institutions, which means that the ties are thicker, because it means that those institutions, that are my nodes, are sharing more people together. So they have many people working here and people working there. They're also sharing information to each other. So we have that within the disability network, the strategy behind was to improve the relationship with the education institutions and really focus on that. The strategy for the Aboriginal and Torres Strait Islander coordination network, it was actually to go everywhere to try to increase the connection everywhere. And that is why it looks like more spread. So the thing that made us all thinking with the children, Queensland Health and the team that we were working together on that, because it's like, can we really map and understand that we have a different broker sharing, different sharing patterns for behaviors, about sharing knowledge that is also depending on the type of governance that we are also having within each network. Maybe not. In the literature, what we found, there is this idea that having a network with a lot of brokerage, it's actually not a good idea, because it might create fragmentation. I think this is opening a lot of questions about the governance strategy and what does it really mean, fragmentation and integration, and I don't really know if I don't believe that the network with lots of brokers were actually less resilient and less integrated than the other one, even though we found higher brokerage and less transitivity. So I think we should rethink about the link between the network, the social network analysis results, and the governance, because I think probably there's something there. But this is for more. Okay, and now we are gonna go back to the very end. This is some of the final. So we ended up saying, okay, we do this research, and then so what? So what we did, it was to make a booklet for all the participants to report some of the results, which is not, they own the results at the end of the day. And then we also suggested a small intervention. So we were inviting them to go and grab a coffee with some of the colleagues with different expertise, trying to close the trial. Anyway, and then part of the design is coming from Maggie Dean Douglas. I never remember the names correctly. That she made the drawing, and that is why we also use part of the drawing as an art installation in the room that they have been using for all the ECHO video conferences within the Children's Hospital in Queensland. So one day I'm going to go back to see the art installation. Okay, the final things that I want to say very quickly is related to what we discussed, what we know about this United Nations campaign that is happening right now from the 25th of November until the 10th of December. The website, there is like a campaign agent to fight the violent against women and girls. And the website is rich. There's plenty of materials that people can use, a specific section for researchers. And the reason why I'm presenting this is because if you can see, they are proposing different pathways to prevent violence against women. And one of the things is training for behavior change. Now, this is what it means doing an end-to-end intervention in public health and in healthcare. That's how you do. You train people, and then you hope that this is going to change their behaviors. And what you can find in this wonderful publication on page 26, it's something that we have been discussing a lot, because they are talking about networks, they're talking about creating the opportunity of sharing formally and informally, and they're talking about being an effective bridge. Now, even though everything that we have been talking about, it might not be exactly your type of research, I think it is really important to, I mean, what I hope is that I gave stimulated a little bit of curiosity, because what we have been talking about, networks, bridges, transitivity, closure, sharing, formal and informal, is becoming really part of the mainstream and part of our knowledge of everyday life. So I really hope that I stimulated a little bit of your curiosity. And final things, okay, this is me, this is my email. I want to dedicate my presentation to my dad, because today is actually the 20th anniversary of his death, and then I think it's one of the best supporter, because I wouldn't be here literally, but also because in my family nobody was, especially the females, I'm probably the only one who actually finished the high school, so left behind everything else. Questions, and thank you very much.